Hello everyone, welcome to GrowMed. In this video, we will look at some important one-line questions from the gynecology. So the one-line questions which were asked in the previous years in the FMGE exam, I've tried to cover all those points here in this video. So there are chances that the question might be repeated, or if not, then the topic at least will be repeated. So you must know from which topic the questions have been asked in the past years. So let's start the video. The best support of the uterus, and the answer is the cardinal ligament. Okay, so the next question. Inferior one third of the vagina, and it is derived from the urogenital sinus. And if the questions are asked from the upper vagina, then it is derived from the Mullerian duct. Upper two third derived from the Mullerian duct. Okay, so the next question. In a normal menstrual cycle, lowest amount of the estrogen and the progesterone is seen at which phase? And the answer is the follicular phase. Then moving on to the next question, the most common cause of secondary amenorrhea. So questions usually on the secondary and the primary amenorrhea, they are asked like a clinical case. Okay, so you need to know the cause so that you can easily find out the answer based on the clinical features which are described in the question. Okay, so the most common cause of the secondary amenorrhea, first is the pregnancy. Okay, and the next most common cause is the PCOD. Along with that, if there is a history of DNC or abortion, then the answer can be marked as Asherman syndrome. Okay, so these were few important topics which causes the secondary amenorrhea. Moving on to the next question, most common cause of primary amenorrhea, and the answer is the gonadal dysgenesis. And a very important cause of the gonadal dysgenesis is the Turner syndrome. Okay, and the chromosomal abnormality associated with it is the 45XO. Okay, so Turner syndrome also a very important topic. Questions are asked usually the clinical case in relation with the pathology या फिर OBG में या फिर मेडिसिन में, क्योंकि इसमें ना बहुत सारी फीचर्स देखने को मिलती है, जैसे कि कार्डियक डिफेक्ट्स रहती है, देन शॉर्ट स्टेचर. ठीक है, तो ये सारी चीज़ें यू नीड टू लुक एट. Then moving on to the next question. The gland that opens on the posterolateral margin of vaginal opening, and the answer is Bartholin gland. Okay, so this gland opens in the posterolateral margin, and abscess of this gland causes discharge. So the most common organism involved is the E. coli. The most next question, most common test of ovarian reserve. The answer is the serum FSH. Okay, we perform it most commonly, but if the question is asked best test for the ovarian reserve, and then the answer will be the anti-Mullerian hormone. Okay, so these tests usually done in a post-menopausal. So these tests usually done in a premenopausal woman, okay, or a menopausal woman. Then first polar body is released at the time of the puberty or the ovulation, and the second polar body released at the time of the fertilization. नेक्स्ट मूविंग अ वेरी इंपॉर्टेंट टॉपिक आस्ड मल्टीपल टाइम्स एल एच सर्च. ठीक है, तो ये जो एल एच सर्च है ना, इट वॉज आस्ड एज अ इमेज बेस्ड क्वेश्चन की ग्राफ दे दिया है 4-5 हार्मोन का, एंड दैट मार्क्ड कि ये वाला व्हाट डज इट सिग्निफाई. ओके, एंड दिस वॉज आस्ड इन द जैन एंड जून 2022 ऑल्सो. ओके, तो एल एच सर्च होता है इस्ट्राडायोल की वजह से, और ये एक बहुत इंपॉर्टेंट फैक्टर है ओव्यूलेशन के लिए. whenever there is ovulation, whenever there is LH surge, ovulation will happen. Okay, the next question, labia minora is homologous to which organ in the males, and the answer is the glans penis. Okay, then corpus luteum formation occurs on which day? So it occurs on the 15th day of the menstrual cycle. Okay, just after the ovulation it will happen. Then most common symptom of the genital TB, and it is infertility. So usually this question, जेनाइटल टीबी ऑल्सो वेरी इंपॉर्टेंट टॉपिक. सो क्वेश्चन आर आस्ड कि एक फीमेल है, ठीक है, उसको टीबी था, तो स्कारिंग हो गई है, एडहेशंस हो गई है, प्रेजेंस टू यू विद द इनफर्टिलिटी. ठीक है, तो नेक्स्ट स्टेप क्या करोगे, या फिर क्लिनिकल केस दे विल बी गिविंग that a female comes with a complaint of infertility, and when you do the examinations you find out that beaded appearance of the fallopian tube. ठीक है, then what will be the cause? Then it will be genital TB. Okay, and if it is treated genital TB, then there will be risk of ectopic pregnancy. So let me write it here. Okay, so the treated genital TB, it will present as an ectopic pregnancy. Then moving on, vaginal secretions. These vaginal secretions are mainly due to cervix. Then the next question, epithelium of the fallopian tube, and this is made by the ciliated columnar. ठीक है, and this was asked in the anatomy also. The first histopathological evidence of the ovulation, and the answer is the subnucleolar vacuolation. So this question was asked in a different manner. The first histopathological, this was asked कि सिक्रीटरी फेज में एंडोमेट्रियम में क्या देखने को मिलता है, ठीक है. तो ओव्यूलेशन के बाद तो सिक्रीटरी फेज स्टार्ट हो जाता है ना. सो इन दैट फेज यू कैन सी द सबन्यूक्लियर वोक्यूलेशन. So this question was asked in the June 2022. Okay. Then moving on to the next question, imperforate hymen. The treatment of this imperforate hymen asked multiple times in every year, all the time. This imperforate hymen question is asked either as a clinical base or as a image or as a one-liner. ठीक है. So clinical case में it will be very easy कि 16-year-old primary amenorrhea and cyclical abdominal pain, but on examination a bulging hymen, okay, bluish bulging hymen. So what is the diagnosis? Imperforate hymen. And how will you treat it? By doing a cruciate incision on the hymen. The most common ovarian tumor, it is the epithelial tumor, and the subtype of the epithelial is the serous cyst adenoma. Most common germ cell ovarian tumor, it is the teratoma. Okay, तो teratoma की usually image based question पूछी गई थी. Okay, जिसमें you will be seeing teeth, hair. Okay, and this is also called as a dermoid cyst. The next question, most common tumor to undergo torsion, and the answer is the same, the dermoid cyst. Then most common malignant germ cell ovarian tumor is germinoma. Mechanism of action of combined oral contraceptive pills. So it prevents the release of the ovum from the ovary. Okay, then moving on, primary treatment for hirsutism in PCOD, and it is the combined oral contraceptive pills. ठीक है. Hirsutism के लिए we will be using COCPs, and drug of choice to treat infertility in the PCOS, it is the letrozole. Then the next question, EMSEL's criteria used for the diagnosis of the bacterial vaginosis. ठीक है. तो bacterial vaginosis also very important topic, क्योंकि questions इस पर भी पूछे गए थे. ठीक है. So you can see in this the whiff test, fishy odor. Okay. So ये सारी चीज़ें belong करती है EMSEL's criteria के लिए. Likewise और एक criteria use होता है, and that is the Rotterdam criteria, which is used for the PCOD. Okay. So the next question, the normal vaginal flora made of the lactobacillus. ठीक है. So I guess ये वाला question ना उसमें पूछा गया था NEET PG में. ठीक है. Okay, so investigation of choice for endometriosis, it is the laparoscopy. So question was asked describing a female कि उसको dysmenorrhea था, dysgerminoma था. ठीक है. Okay, so जब भी question में dysmenorrhea, dyspareunia, ठीक है, ये सब डिस्कस करके रहेगा ना, then you need to think in terms of endometriosis, क्योंकि यही एक condition है जिसमें बहुत ज़्यादा पेन होता है. Okay, और endometriosis के लिए laparoscopy is the best investigation. Then moving on, treatment of the endometriosis, it is the GnRH. Okay, हम देंगे यंग फीमेल में, एंड इफ़ द फीमेल इज़ एल्डरली देन हिस्टेरेक्टोमी. जैसे कि उसने अपनी फैमिली कंप्लीट कर लिया है एंड नाउ शी डजंट वांट टू कंसीव, देन वी कैन डू हिस्टेरेक्टोमी. देन द नेक्स्ट क्वेश्चन, मैनेजमेंट ऑफ द डिक्यूबिटस अल्सर. तो इट इज़ द पैकिंग. ठीक है. एंड द कॉज ऑफ द डिक्यूबिटस अल्सर इज venous congestion. Then management of the fistula. Then most common type of fistula, it is the vesicovaginal fistula, asked every year in every question. तो vesicovaginal fistula a very important topic. सारे points इससे related. Image भी पूछा गया है, तो you need to look for the image also. And diagnosis कैसे करते हैं? 3 swab test के साथ में करते हैं. And the most common cause of vesicovaginal fistula is obstructed labor. The cost effective screening test for the cervical cancer, it is the VIA. ओके, तो एसिटिक एसिड से हम जो विजुअलाइज करते हैं ना सर्विक्स पे, दैट इज़ द मोस्ट कॉस्ट इफेक्टिव. देन फिल्टर यूज्ड इन द कोलोनोस्कोपी, इट इज़ द ग्रीन कलर. एंड द लास्ट क्वेश्चन, कैंसर दैट कैन बी प्रिवेंटेड बाय द वैक्सीन HPV. So the last question, cancer that can be prevented by vaccine, and it is the cervical cancer. क्योंकि cervical cancer, as you must know, the causative agent is the HPV. ठीक है. 16 and 18. तो क्वेश्चन इस पर भी पूछे गए, द मोस्ट कॉमन कॉज ऑफ सर्वाइकल कैंसर. तो जब इट इज़ कॉज्ड बाय अ वायरस, देन इट इज़ मोस्ट लाइकली दैट इट कैन बी प्रिवेंटेड. ठीक है. एंड दिस वैक्सीन इज रिकमेंडेड फॉर ऑल द फीमेल इन द रिप्रोडक्टिव एज ग्रुप. ओके, so that's it in this video guys. I hope you find this video useful and it will help in your revisions. ठीक है. सो इसमें ना मोस्टली गायनाकोलॉजी के वन लाइनर्स मैंने यहाँ पर कवर किए हैं. ठीक है. तो ऑप्स के वन लाइनर आई विल बी सून पोस्टिंग अ वीडियो ऑन दैट ऑल्सो. एंड ऑलरेडी आई हैव पोस्टेड वन लाइन क्वेश्चन फ्रॉम अदर सब्जेक्ट्स. एनाटॉमी के लिए फार्मा, बायोकेमिस्ट्री, पैथोलॉजी, इन सब के सब्जेक्ट के मैंने ऑलरेडी अपलोड कर दिए हैं. यू कैन गो एंड वॉच देम ऑन माई यूट्यूब. So thank you guys for watching this video. All the best for your exams. Like the video, share it with your friends and subscribe to GrowMed. Thank you guys. Bye bye.